that I read earlier today. I should took a screenshot about Pennsylvania's home care landscape. Actually, let me make a copy of it so I can read a little bit. So even if you're not in the state of Pennsylvania, you can listen to this and then it could give you some insight about how things go in each state. And but if you're specifically in Pennsylvania, this is for you. So let me first share. I can say a little bit, it's going to be a little bit hard for me to keep switching my screen. So if you are, if you want to join me on YouTube, you'll be able to see things just a little bit better because I'm on multiple screens. So it's going to be a little bit challenging for me to switch my screen. But first, let me get started. Hey, my name is Sean, aka the Savvy Business Chick. I am a home care business mentor, and I help people start, grow, and scale their home care business. So, again, today an article came out about the Pennsylvania Healthcare Agency's upcoming state budget, right? Again, if you want to see what's on my screen, because I have my YouTube, my TikTok, my Instagram, you might want to go over to my Savvy Business Chick YouTube channel so you can see this a little bit better because it's hard for me to switch my screen. Okay, so let me read this. Let me read a little bit of this first, and then we're going to dissect what this means. Okay, so directly from the article, that Pennsylvania home health agencies, all this year, there has been a lot of great advocacy in Pennsylvania. So shout out to Pennsylvania's home care or home health care associations. If you guys have never heard of healthcare or home care associations, one of the things I do like about them is that they are really big with advocacy within your state. So this one is specific, of course, to Pennsylvania. And the two things that they have been trying to advocate for and or address since the beginning of this year, 2025, before there was a OBB, One Big Beautiful Bill, before any of these changes were in place, even before Dr. Oz got nominated and assigned as director of CMS. The Pennsylvania Home Care Association has been advocating for higher wages. And so higher wages, you would think, well, why would they be doing that? Why would they want to have to pay their workers more? By them advocating for higher wages, this also in turn associates with higher reimbursements. So let me read a little bit of what, hey, good day. If you're just joining me, please do let me know where you're located. I always like to know where you guys are watching me from. It lets me know that I'm talking to my people. And if you want me to speak more about your state, I need to know where you're located. So, okay, so Pennsylvania home health agencies have called for, meaning they're, talking to the governor's office for a $370 million line on the state's budget. Now, you may think that $370 million is a lot. Well, Pennsylvania has a exceedingly growing aging population, which we talked about when I was telling you guys about the silver tsunami that's coming. Pennsylvania is actually one state that is going to be pretty hit by the silver tsunami. And so they're asking the governor to make this a priority because let me just read some more. So home health agencies say Pennsylvania's rapidly, and I also link the if you're not on YouTube where I'm sharing the article, um, I will link the article so you can read it for yourself in my sorry, brain freeze, in the in my stories on my Instagram stories. Okay. Home health agencies say Pennsylvania's rapid aging population and low reimbursement. So Pennsylvania is unfortunately known for its low reimbursement, are unsuitable. So now they're saying enough is enough. All right. So there are some key things in this article that will be helpful for you if you are an existing home care business owner in Pennsylvania and or a aspiring one. So again, listen if you're on Instagram or TikTok, or go on over to my Savvy Business Chic YouTube channel if you want to see the article I'm reading from. Okay, so Pennsylvania in-home healthcare agencies that provide basic medical assistance and daily personal care to homebound patients say the industry is on a crash course collapse as the state sees rapid aging population. So I had someone DM me on Instagram saying, "Oh, I heard they're not giving out any more licenses." Well, newsflash, we just got 2 people licensed in the state of Pennsylvania, and our average, whether you work with me in my home care Kickstarter program or are using our DIY kit, is about 2 months. You're going to see that return, right? So I just posted on my feed. We got a new testimonial, and that's also to show, hey, thanks so much that we work with real people. Hey, Erica, we work with real people who get real results. Okay. All right. So what's going on right now is that the rising aging population in Pennsylvania is becoming overwhelming, but basically, if you are a Medicaid only if you're a Medicaid provider, which they have some, they have MCOs. I'm going to go over the MCOs because I'm sure you guys have heard about the MCOs, um, because that's like a big topic whenever someone wants to get started in this business. And then they also have some Medicaid waiver programs. Now, if you have grabbed my book on how to start, unlocking the multiple ways that you can get paid in your home care business, I want to remind you that there are essentially up to 3 ways that you can get paid in a Medicaid program, and most states have all 3. All right. So if I'm not catching up with your comments yet, just take notes, put this in the comments, and let me know that you are following me. There are 3 ways that you can get paid, right? We have Medicaid. You have Medicaid is number 1, right? So all states have Medicaid because Medicaid is state funded. Then you have your Medicaid waiver programs, right? Medicaid waiver programs are individual and they are broken down by a target audience. I'll just say it like that. Then you have your Medicaid MCOs, right? So, hey, Maureen. So if you have not already heard that those are the 3 tiers for Medicaid, give me drop an emoji. I'll just say drop an emoji. If you never heard that there are 3 tiers for getting paid in Medicaid, which is Medicaid in general, Medicaid waivers, and Medicaid MCOs, drop an emoji because I want to make sure that I am helping you as I'm just going over healthcare news. This is healthcare news. And guess what? I can get on here every day, almost, because I do have a small kids. And guess what? We're still never touching the tip of the iceberg of everything that this industry has to unfold. So that's what makes it, to me, that's what makes it a um, recession proof, recession resistant. I think I like that word better. Recession resistant. Like when recession tries to come, we're like, pump your brakes. This is how we're going to handle you because people need care, right? All right. Okay. So let me finish reading. Okay. Pennsylvania in-home health agencies that provide basic medical assistance. So we know that is non-medical. We know that is non-medical. Okay, so service providers say historic gaps in funding. So that means they're telling the state, you have a problem, you better fix it because the funding, the reimbursement that they're getting from the state, and we're talking about Pennsylvania today, is not matching the staffing shortages. They're like, you can, if you continue to pay us these low rates, and we're paying our caregivers, we're going to see an exodus, right? Which has started to happen a little bit. Some um, caregivers, home health aides, CNAs, they are starting to work in states like uh, they're leaving Pennsylvania and starting to work in states like New Jersey and I think Delaware was listed. Okay, so the crisis has actually reached lawmakers in Harrisburg. So if you're reading the article with me, thanks for the hearts. So the state is basically trying to negotiate, and they've been doing it since the beginning of the year, but it's dragged on through the summer. I like that it's dragging on through the summer because that means it's still at the top of their discussion, right? And because I work with legislators on the state level and on, the federal level, like legislators need to be educated, and for them to be able to make a decision they may have to talk to multiple people, right? They may have to balance out multiple audiences. So the fact that this is dragging on through the summer is not a bad thing, right? It's a good thing, um, so that they can lean on the side of both the consumer, who are the clients that you would serve, and the providers, right? So they're basically what they're saying in the article is that they're requesting an additional 370 million to help pay for wage increases, new hires, and expanded services. So that's what the $370 million is to cover in the state of Pennsylvania. Pay for, they want to give caregivers wages, right? They want to be able to hire good talent and they want to expand services. So those are three things that they're trying to do with this $370 million added to the budget, right? So what they've pointed out to the governor, to other legislators, is that Pennsylvania has gone years, decades of being underfunded, right? Why they're saying that is, if you've never heard of the term case study, they're what they've been doing, it's not necessarily in this article, but it's been in other articles I've read, is that they're showing the governor, showing these other legislators who would vote on approving this, right? Because remember, when it comes to dealing with legislators, whether it be on the state level or on the federal level, you have to educate them. So what they did was that they showed them different models of other states' Medicaid programs, right? So they said, look at New Jersey's, look at Ohio's, right? Look how much they're paying for the same service. And you do a comparison, right? please, I'm not trying to go too far over your head, but I definitely want to explain this in a way that you understand it. Right. So right now in the state of Pennsylvania, the House of Representatives, they have a House of Representatives um just like the federal, is controlled by Democrats, and the Republican Senate of the state is controlled by Republicans. So they're now trying to um have a happy medium on approving this um for the fiscal year. Now, if you guys have been watching me or tuning in to me for some time, you may have heard me say that the state's fiscal year ends in June, like June 30th, and a new one begins July 1st. So right now, they have not approved what is supposed to be on this year's budget, right? But they're still working on it. So here is the market research that you need to know. It's right here in this article, right here. Let me make a copy, and I'm just going to paste it in the comments. And believe me, I am going to get to your questions. Please give me just about 5 more minutes to educate you on this, okay? Okay, so guess what? According to the research, there are 400,000, somebody write that number down, 400,000 children and adults receive in-home care services. That's only in the state of Pennsylvania. So when you guys come to me, you say, oh, the market is saturated, that area is saturated, it's so many providers. Okay. Nope. 400,000 children and adults are not being served. That's how many people are approved, but not everybody's being served. And it says, according to the Pennsylvania Home Care Association, which only represents 700 home care providers, that the services can include skilled nursing, which is on the home health side, physical therapy, which is on the home health side, occupational therapy, which is on the home side, respite care, which is on the non-medical home care side, meal preparation, which is on the non-medical home care side, help with activities like dressing and hygiene. So we have 3 skilled and 3 non-skilled. Are you guys seeing that? 3 skilled and 3 non-skilled. Now, this Pennsylvania may not be your state, right? We're going over Pennsylvania because this article is literally today. This is healthcare news today. And what I want to teach you, see, it says August 6th. What I want to teach you is, even if this is not your state, start looking for information in your state for information like this, right? Because if you haven't got started, this should really motivate you, right? If you haven't got started, it should really motivate you. And if you have got started, this should motivate you too, because you have probably missed several opportunities. Number one, playing it small, not having an understanding of your population that you need to serve, and also knowing what is the state's agenda. What is your state's agenda for helping these people? And by the way, I forgot to ask, if you guys can be so kind, I love those hearts, because today I'm not gatekeeping. So don't you gatekeep with those hearts, right? The hearts are free, and it definitely helps me get out more on the Explore page, the FYP page, and even YouTube has its own algorithm. So please, boop, 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 tap that screen, tap that screen. Okay, all right. So again, if you're on YouTube or Facebook, you can actually see the article I'm sharing. All right, so here is a quote from an actual caregiver. The work is vital in supporting aging seniors and people with disabilities and chronic illnesses. Write that down. These are your 3 main people: aging seniors, It says it right here in the article. No gatekeeping, no hiding. This aging seniors, and type it in the comments if to let me know that you are following. People with disabilities, that's number 2. Or people who have chronic illnesses that want to stay in their homes in the communities. Those are your 3 main populations, right? And even if you don't understand that, remember, we go over this more in depth in my home care Kickstarter program, so you can understand your client, your customer, your consumer. All right. Okay. So this caregiver was saying you're transferring people and moving people around and ambulating them. She said in a hospital or nursing home, there's a huge amount of staff that can help with those tasks. But when you're in the home, you're the only one. Yes, home care, caregivers, the nurses, they work independently. And there's a benefit to that, right? Because if these nurses, if these home health aides, if these CNAs, if they were working in a nursing home in a hospital, they would have about anywhere from 30 to 40 clients in one day, right? But in home care, even though at times it can be a little bit challenging for them to, do bed to chair transfers or chair to bath chair transfers because they're the only one. Guess what? The benefit is that you only have one client. And that's why a lot of new home care businesses really took off even during COVID. Why? Because the risk of going into a facility versus going into one person's home that that you have, you're able to, monitor who's coming in, who's coming out, and to make sure that the environment is safe and clean. You have a higher chance of controlling infections. Okay. All right, so I gave you guys the population. And let me just say that 400,000 children and adults, that's only Medicaid. It does not include, that's only Medicaid. It does not include people who are, who pay privately, who have supplemental insurance. That's only Medicaid. So that number will be even higher if, hey, Larissa, that number will be even higher when it comes to your other insurers. Okay. All right. So now, guess what? They're sharing the rate. People are always asking me, what's the rate for Medicaid? Because some people want to become a provider with the MCOs, but they haven't obtained a contract yet. Okay. So guess what? Right here in this article, again, if you want to see the article I'm reading, go on over to my Facebook page or my YouTube page. The average base rate in the state of Pennsylvania for an employee who does ADLs, who's a home health aide, CNA, is $15.69 per hour. Write that down. That is the going rate. Can you believe it? Can you guys believe it? Put that in your budget. Put that in your budget. That's the going rate. And guess what? I do know people that make less. I actually helped a young lady around Christmas time. I gave her my DIY kit for ridiculously cheap. You know why? Because she told me she's a caregiver making $9.80 an hour. And I was like, there's no amount of saving she would have did paying her bills, working that case, where she would have been able, to afford my DIY kit, even when I put it on sale. Just because, I mean, that's a rate of struggle. That's a rate of, you only have this much left by the time you pay your bills. So it was my pleasure. And she actually has a review on my Google business page that she got licensed. And so now she's able to be her own boss. Hey, hi, Carlene. right? So I do things like that, right? Because I can, right? So $15.69 is the median rate, but just so you know, it's a median rate. That means that people make less. All right. All right, let me okay, so here's another fact that I found in this article I definitely wanted to share. Okay, so because okay, let me read this part. We have folks that really love to do basically provide the service. But then they why did it jump down? They realized that because they're making such low rates, they can't continue to do this kind of work. You know, at $15.69 an hour, you have a bad day. What's stopping you from getting a job at Walmart? What's stopping you from getting a job at Chick-fil-A, right? So that's why the home care agencies are really advocating that they need an increase in the budget for the state. All right, so here you guys remember I said 400,000 uh, people who need or get home care services between adults and children. Guess what? It says that more than, I'm reading it clearly, more than 112,500 home care shifts go unfilled every month in the state of Pennsylvania. You guys seeing that? Why? Because of um the shortages, right? Because technically, how I want to interpret it, if you're not able to pay this 1569, then if you're not able to pay that 1569 an hour, then and you're paying lower, then the caregiver after a while is going to seek other places to work. And you can't blame them. And that's a decision for the agency, right? The agency has to be, if the agency wants to be more profitable and not you know, benefit their worker, they're going to bill them at they're going to pay them at lower rates, right? So what's happening is that a lot of workers are leaving Pennsylvania for bordering states like New Jersey and New York, where they can earn on average a higher hourly wage. Okay, so let me stop sharing. And let me explain what that means. So first, let me go look at some of these questions. Oh, thanks for sharing the live. Thank you. All right. All right. Let me go. Okay. Good day. Hey, North Carolina, Tennessee, New York, Ohio in the building. Okay. All right. Thanks so much. Hey. Okay. So this is not something to be afraid of. Hey, I'm just seeing. Eric, I'm not sure if he's still up here. I am going to DM you after I get off here. Oh, thanks so much for the hearts. I'm just seeing this. Hey, Savvy, how do I apply for you guys to help me? My application's under review. You should try to get on a call with me tomorrow. You guys know I do free calls every Thursday. I think I may have 3 spaces available. Okay, yes, we can definitely help. Get on my calendar tomorrow, guys. Free call. Connecticut is a good state to Connecticut is a good state to start a home care business. Very, very, very quick turnaround for your application. However, Connecticut takes a year for you to be Medicaid approved. But don't worry, they got plenty of private pay clients in Connecticut. All right, I'm making sure You're interested in a one-on-one class? Tia, where are you located? Hi, Sydney. Did you see what I said? The reimbursement rate? I mentioned that earlier. Oh, maybe I didn't get to that part yet. Did I mention that? And guess what, guys? No gatekeeping. I'm sharing this article. I'm sharing this whole article because this is real news. This is a real article. These are real numbers. Um, what I just saw it. I want to take. I just saw it. For some reason I'm not seeing it. Maybe I'm moving too fast. 2305. 2305. Thank you so much for showing me love. $23.05 is a reimbursement rate. Very low. That's why I don't want you guys to be Medicaid heavy. You know why? Because being Medicaid heavy, you have to have volume. Do you guys understand that term? You have to have volume if you're going to be profitable with Medicaid rates. If you understand that term, give me the thumbs up. If you don't understand that term, give me the thumbs down. You got to have volume. I'm looking for that so I can share it. I know I just saw it on this thing. I don't know what I just did with it. Okay. And I kind of jumped. So basically they're handling it. And okay, so I'm gonna stop looking for it. Okay, so you understand you gotta have volume. Okay, so I don't have to explain that. Okay, so you guys understand that. Okay. What are you saying? Yes, because different. Okay, let me read off the different MCOs. Yes. Okay, so every MCO has its own rate, right? Every MCO has its own rate. Okay, so in Pennsylvania, these are the MCOs, and they're different depending on your zone. Okay. Oh, thanks. No problem. You know, we have Amera Health, right? If you're familiar with Amera Health, PA, give me some hearts. Amera Health. Amera Health is by zone. Amera Health by zone. When people say, "Oh, these MCOs are not open," go to their website. Very simple thing. Go to their website. Find out what area they are underserved, right? Because the article just said, in addition to what they're advocating for, there are people who are not being served. This is an opportunity that some people don't want to, maybe they don't understand. So maybe don't understand. Okay, some people get started and they want to work in their comfort zone. What do you mean, Sean? Well, I'm from Pennsylvania. I'm from Philly. So I'm just, I want to serve my community. And guess what? You can serve your community in another part of Pennsylvania. But when I say that to someone, when we get on a free call on Thursday, it's almost like I insulted them by telling them, don't start in Philadelphia. Well, and guess what? They don't take my advice, which was free, but it should have been expensive. And then I've had people come back and say, "Oh, you were right." I don't want to be right. I just want to be helpful. You can easily go to the website of this MCO and say what, and find out Many of them have posted what counties they are looking for providers. And my question to you is, if you're really in business to be helpful to if you're really in business to be helpful to help the community, it doesn't have to start in the area that you're the most comfortable with. Your comfort zone has nothing to do with your calling, with your purpose, right? You can help more people where you grew up from if your business was profitable, right? Okay, so then we have health partners. If you're familiar with health partners, give me some hearts. Yeah. And I just talked to some of my Christian entrepreneurs. Some of you you say this is my passion, this is my ministry, right? Right? Okay, okay. There is a part of that you have to be profitable if you're going to help more people. I mean, I honestly just can't put it any other way. You're at, because I can profitable in my first home health care business, profitable in my second home care business, profitable in my other three businesses. If someone says, oh, you know what, I can't afford that, and I feel led to help them, whether it's for free or for discount, I can do that. I can do that, right? But for you, if you start out, okay, because someone asked me, Sean, how come you never share? Um, this is a good one. Someone asked me, Sean, oh, hey, Lois, Sean, how come when you're talking about starting a home care business, you never share it from the aspect of a nonprofit model? Let me ask you this. How are you going to have a nonprofit business getting reimbursement from Medicaid? Riddle me that answer. When you can answer me that question, how are you going to have a nonprofit home care business getting reimbursed by Medicaid? What is your answer for that? What is your give me your answer, because it's not making any sense to me. Okay, now we have UMPC for you. If you heard of UMPC for you in Pennsylvania, give me some hearts. UMPC. UMPC. Helping is helping. I love that. Yes. Okay. All right. That's another one that really depends on the zone. So if you're hearing this, go to their website, go to UMPC for you. Yes. Type that in, and their Pennsylvania Medicaid MCO, and then go to their website and find out what counties do they need providers in, right? Everybody's heard of Keystone, right? Keystone is primarily in the Philadelphia area, and people are so disappointed when they can't get a contract with Keystone. Why? Because everybody they know and want to serve has Keystone. So as soon as someone in the Philadelphia area gets licensed, first you got to get licensed, then you got to go become a Medicaid provider. You got to go through the promise application, which is a whole separate application and credentialing process. And then they get approved, they get a promise number, and they just think, oh, I have made it, I've made it, I've made it. And then they go start telling all of these old neighbors, people that grew up with them, okay, all right, so I should be able to provide service for you now. And then they realize, oh, there's another step. Yep, there is another step, and it's called getting credentialed with the MCOs. So remember, at the beginning of this conversation, I said, you have three levels to the Medicaid. You have Medicaid, which is your entry point. You have your Medicaid waivers. So if you want to provide service to someone on a waiver plan, like 150 or Oprah, right? you have to individually go through their requirements, right? And I think a lot of people are like intimidated by the Oprah waiver because it requires additional training, right? So, but and then you have your MCOs. So if the MCO says, um, um, we're not uh we're not taking any new providers at this time, then you guys go and try to discourage other people like this is a fraud. Starting a home care business is a fraud. It doesn't work. It doesn't work. No, you started in the wrong area, right? They're looking at your application. You say you only want to work in you only want to work in one area. Okay? So then you miss your opportunity to say, hey, I'm a provider that's done a little bit of research before submit my application. And I see that in Washington County, you need more providers. And so uh, I can provide service in Washington County. And then they ask you for additional information. No, they didn't stop allowing new agencies in Pennsylvania. You can get a license, right? You just they're just it's when you go submit an application for the MCOs, they're going to tell you um they're not accepting any providers at this time. So it's no surprise. I make sure anyone who works with me, you know, as long as you're comfortable with starting a home care business and that you may not be able to get approved with the MCO because you're putting Pennsylvania as your main counties. If you're okay with that, I'm okay with that too. Because the other counties, you don't really hear about other areas complaining as much. I just had a mentee in Lake County. Guess what, guys? He's been licensed since February. He's been licensed since February. He just got a contract with the city. He just got a contract with the city. I'm not going to tell you which city because he ain't in Philadelphia. So there's plenty of opportunities out there. Okay. Coventry Cares and Gateway Health. Coventry Cares and Gateway Health. All right. Coventry Cares and Gateway Health. That's located in some zones. Right? And then this one, Gassinger Health Plan. Gassinger Health Plan. These plans are a part of the MCOs for non-medical, non-skilled. Okay. So again, what you have to do is you have to go to their website. And if you're wondering, like, well, how can I do this? How can I do this? I don't live there. Most of you are concerned about how can I live in Philadelphia and service Washington County? And I want to help you. I want to guide you to this thought. You don't have to. You don't have to eat where you live. You don't have to make money where you live. You know what? It's people every Monday fly to their job. It's people every Monday take a Amtrak train to their job. I want you to wrap your mind around you can service other counties in your state. I can service other. I'm not trying to make. I don't want you to feel stupid, but I want you can service other counties in your state. You can do it. If you got to repeat this affirmation for the next 30 days, I want you to renew your mind that you can service other counties in your state. You can do it. Thank you so much for the follow. You can do it. All right. So My last point on this, this is a good sign for people who are in business or who want to get in business. You know why? Because the state, the bigger agencies who pay their annual fees to this home Pennsylvania Home Care Association, they're doing the heavy lifting for you, right? I remember one time when I was a member of Maryland's Home Care Association, on top of my monthly fee or annual fee, we ran into a problem that was going to affect business, right? And I think I told you guys initially I started off with 1099s. But the franchises hated the 1099s. So we were kind of like in a somewhat kind of a back and forth tug of war trying to get the state to rule on whether home care agencies should or should not do 1099s, right? And so because this affected a lot of agencies and the Home Care Association I was in, that they said, well, you know what? The best way for us to handle this is to hire a lobbyist, right? And when we did, each of us had to pay $10,000 for the lobbyist to address this one issue, right? So my portion was $10,000, another agency portion was $10,000, right? So when I say this article is good if you're an aspiring home care business owner, or if you're a small business owner and you're trying to grow your business, because the bigger agencies are footing the bill, right? Because they've been advocating for this since January, to the point that now they've gotten the attention of the governor. This is a good sign for you. They're doing their case studies, comparing Pennsylvania's reimbursement to other states. They're pushing the need um, for jobs, because home care, home health care, we provide jobs. We provide jobs. And we take care of some of the most vulnerable in the community, the disabled and the aging. So this is a good sign. I didn't share this with you to be discouraged. One of the things that home business owners, whether you're home care or another industry, is that we're problem solvers. And this is where you are putting on your CEO hat, because you have to learn how to navigate through these type of things so that your business can be successful. All right, so I'll take a couple of questions and then I'll jump off here. Ingrid, you said, what are the steps after submitting a home care application? Do you mean for Pennsylvania? Are you in Pennsylvania? What are the steps after submitting a home care application? I'll wait for you to answer that before I have a home care business, and this has been the hardest business for me yet. Need help. Hi, modern day girl. Where are you located? Good afternoon, body lady. How do you sign up for a call? Easy. You can go to the link in my bio. And if you go to the link in my bio, you click the link wish I could share my screen. You click the link, it's like a link tree, and it will take you to my, you can jump on a free call with me. Your first call is free.com. And I do calls like that on Thursdays. I think I have about 3 appointments available. Jump on my call after we get off this live. Jump on my calendar. I'll call you. I'll give you real advice. And guess what? No strings attached. Whether or not you want to work with me or not, I'm giving you advice. I literally had a mother and son sign up with me for this upcoming home care Kickstarter program. The son got on a call with me one Thursday, and the mom got on a call with me the next Thursday, right? I didn't be like, oh, you can't do that. She had her questions, he had her questions. And they have been doing this for a long time, and they said they were going to finally be legit, right? So, and she said she is not short of private pay clients, but she wants to do it right. So she is not she wants to do it right, and she wants mentorship. Okay, so to answer your question, since you're in PA, okay, so and by the way, I have a free um what you should do before starting a home care business, and like about 21 steps that you should take when starting your home care business. That's a free webinar, and if you click the link in my bio. All right, so of course you get your business registered, and you have your EIN. That is your business structure. A lot of times people contact me and say, oh, I've already started my business. Technically, yes. Technically, you've already started your business. You get your business registered, right? Your business is on the books, right? But for most of us who are in a regulated state, we have to go through the licensing process, right? So depending on your state, thankfully for Pennsylvania, the licensing process, if you get our help, it will take 3 months or less. We're averaging at like 8 weeks, right? And so with that being said, after you get licensed, then you can immediately go after credentialing. And that's where I was talking about getting your promise number with OLTL. And then after that, you can apply for the MCO. So those are 3 steps, right? In between that time, I'm always going to recommend that you start doing some business development. The business development is actually working on getting your business out there. If you haven't already developed your marketing tools, you need to get your business out there. Oh, Rakima, I'm sorry to tell you that whether it's Maryland, Virginia, Pennsylvania, Ohio, Texas, Connecticut, after you get approved with any state, her question is after approval for RSA in Maryland, does the state provide you with referrals? The answer is absolutely emphatically no. The state will never give you any referrals. Nope. That's why you have to market your business. So, in finalizing, Ingrid, you register, you have your business structure, you get licensed, and then you do your you do your credentialing with OLTL, and then you apply for contracts. Apply for all of them. Some of them will say no. Some of them might say we're going to put you on a waiting list. And you have to have a regular schedule of going back and following up with them. That's a part of doing business. And what happens is that some people get discouraged. I've heard them. People have said, "Oh man, I was betting on that." They literally were betting on, you know, getting a contract with the MCO again because they got these family members or people they grew up with or people at their church or whatever that said, "Oh baby, I would come work. You can take care of me when you start your agency. You can take care of me." Right? So they betting on that, right? They feel like it's easy. All I gotta do is sign Miss Smith up, sign Miss Robinson up, and then my business is growing. No, Nope. And that's why you got to market. That's why you have to learn to market. That's why in my home care Kickstarter program, we teach your foundation for getting licensed, give you your licensing assistance. Then we teach compliance. Then we teach your operational systems, the main things that you need to do on a weekly and sometimes daily basis. And then we end with marketing. So you have all of the tools that you need for getting started, for operating, and for growing. Hopefully I answered your question. Sultana Bell says, I have my MPI number already. Can you tell me what's next steps from Baltimore, Maryland? If you are not licensed as an RSA, there are no next steps. You can't provide service with a MPI number. And again, I don't know who keeps telling you guys in these Facebook groups, yep, soon after you get your business registered, you need an MPI number. You don't use your MPI number until you're dealing with insurance companies. You don't do that. You've had your license since December 2024. What are you doing with it? Credentialing is a different type of approval, Ingrid, because in Pennsylvania, I have a video on going through the Medicaid process in Pennsylvania. And even though it's a little dated, I think it's like 2 years old, guess what? It still covers what is needed. So a lot of states have their own regulations for the Medicaid program. And so that means you have to have additional policies and procedures for that. So you would have so in fact, for Pennsylvania, you have to produce those additional policies and procedures. And it's about 12 of them. And they're different from the initial licensure. It's not the same. It's not the same. Okay. Oh, thanks, Carlene. Carlene, that was in our last home care Kickstarter. It's saying on Instagram that the home care Kickstarter program, it's we run 3 months where we do live sessions, and then you roll over into our WhatsApp group where I kind of keep my tabs on you. But yeah, you get replays. So you can watch your training over and over and over. Okay, let me take 2 more questions and I gotta go. All right, great. Signed up for a call. I would love to help you about Georgia. I have some ideas why you might be struggling. I have some ideas, but I'll find out. Hopefully, I'm talking to you tomorrow. Love that. K Entrepreneur Talk says EIN number, yes. MPI number, no. I immediately, I agree. Yes, your MPI number, you can't use. You can't use. The step-by-step, what to do from start to finish, that's also the link in my bio. Before you start a home care business, watch this first. I think that's what it's called. Thank you for the gifts. Yeah. Oh, you're welcome. How to assess profitability in the business, average cost of onboarding a new client. I can't answer that question because number one, I don't know where you're located. Number two, I don't know what your products or your services are. I need to see your service menu. I need to see your fee schedule. I need to see your variations for how much you're going to pay your different providers, your different workers. That is not an easy answer. I think what people want me to do is to give a knee-jerk response. Like, we're not the real estate industry. I can't say 40%. What I did say yesterday is that if you're doing a good job, you can average between 15 to 25% of profitability. But we do know that there's a lot of people who are barely get 7%, and that's clearly their fault. You have a great day too. All right, guys. Well, thanks so much. I'm jumping off here. Okay, thank you so much. I'm jumping off here. And for those of you, I invite you to, if you found me on the Explore page or FYP page or, you know, and you're not already following me, go ahead and click that subscribe, that follow button, right? This month, my goal is to go live every day, either at 2 p.m. Eastern Standard Time or 3 p.m. Eastern Standard Time. And guess what? There is so much to talk about when it comes to, oh, that's my donut. Bing. There's so much to talk about when it comes to starting and growing and owning a home care business. The conversations are endless. The conversations are endless. And literally, that was in today's news. And I hope it helped you, blessed you if you are in the state of Pennsylvania. Again, be encouraged. We have two things that's coming up. That is our last home care Kickstarter program of the year. We help both skilled and non-skilled home care agencies. We have a payment plan, or you can finance through Klarna or Afterpay. It does include state-approved policies and procedures. We stand by our policies and procedures, and we're going to give you the training and the mentorship that you need to not just have someone complete your paperwork, right? But so that you can actually know what you're doing and be successful and be profitable. Most people want success, they want a quantum leap in their business, right? But they're not willing to do the uncomfortable, right? They're not willing to get outside of their fear zone, right? And so with mentorship, can you do things on your own? Absolutely. But with mentorship, you go a longer way, right? Because there are some things, hey, Mika, that you don't even know that I'm addressing in the home care Kickstarter program. And it's a total of 6 months of mentorship, and you also get 2 1-on-1 Zoom sessions. So that is for people who are looking to start their home care business. And what if you started this year, but you never had the proper foundation, the proper fundamentals in your business? We also have where you can just come in and take the training and get the mentorship, and we remove the cost of the policies and procedures. We remove the cost of the employee handbook. We remove the cost of the client handbook. We remove the cost of the forms, and you just get into a safe space around your other home care CEO peers, where you can learn and grow your business successfully. And the last thing we have in the month of October, we have our home care startup to stack up conference. I'm so excited about that because we are doing an in-person event for those of you who are either starting up or those of you who are stacking up. And right now we have our tickets are on sale. So that means they are selling out, right? Because I put them on sale. This is my birthday month. I'm going to be doing a couple of things this month because it's my birthday month and I feel like giving. And so if you're on my email list, you will see some of those notices faster if you're on my email list. And then sometimes if you're just paying attention to my stories, you'll also see some I'm actually I'm not going to even answer that, but thank you so much. So with that being said, you guys have a great afternoon and see you tomorrow. Oh, no, I won't see you tomorrow because tomorrow is when I have my calls. And I'm telling you, I have like 20, sometimes 20 calls a day. on my call list. So click if you can't find a link, go to my home care mentor Instagram page and click the link in my bio, and you'll see all of the links that I was telling you about. And talk to you later. Bye. Bye, guys. Did I miss something? Yes, it wouldn't. It does make sense to serve an area that's not near you, such as serving a county that's more than an hour away. Yes, it does. You can do it.